Good morning, everyone. Bonjour tout le monde. Ani. My name is France Gelina. I'm the MPP for Nickel Belt, and for the last 18 years, I have been the health critic for my party, the NDP. I'd like to start by wishing a happy nursing week to all the hardworking nurses of Ontario. Bonne semaine des soins infirmiers. Today, we are bringing forward a time-tested and proven solutions to the crisis in our hospital system. Solutions to poor care for patients, solutions to medical complications and to patient violence, as well as the solutions to nurses burning out, leaving the profession, or retiring early. The solutions target nursing workloads, and it is called ratios, as simple as that. MPP West and I tabled a bill yesterday called Patient to Nurses Ratio. The bill is quite simple. It sets the maximum number of patients a nurse will be expected to care for based on the patient's acuity and needs. Let me give you two examples. The first, patients to nurses ratio, is one-on-one. One nurse to one patient for every patient in the intensive care unit on a ventilator. Another example is one nurse for four patients if she is or he is caring for patients on palliative care at the end of life. Nurse-to-patient ratios have been used for decades in many different jurisdictions, and they work. British Columbia was the latest jurisdictions to do this, to adopt a patient-to-nurses ratio, and they work. By guaranteeing nurses a workload that a human being can handle, because yes, nurses are human beings, it is easier to recruit nurses, to retain nurses, and to bring back nurses who have left the profession because they were burned out, they went into early retirement. Some of them choose to come back. So the nurse-to-patient ratio also guarantees the nurse that he or she will be able to provide quality care, and it has a huge impact on violence that nurses face in our hospital. I would like to invite the president of the Ontario Nurses Association, RN Aaron RS, to say a few words. Aaron.
Good morning, everyone, and thank you for joining us today. My name is Aaron Aris. I'm a proud registered nurse and the provincial president of the Ontario Nurses Association. ONA represents over 68,000 nurses and healthcare professionals and 18,000 nursing student affiliates who are the future of healthcare in Ontario. When MPP Gelina introduced this bill to implement nurse-to-patient ratios last year, it brought hope to nurses and healthcare professionals. It brought hope to us who are dealing with impossible workloads and unsafe staffing conditions. It brought hope because minimum nurse staffing ratios would help us provide patients with the timely, high-quality care they need and deserve. We are here once again to urge MPPs from all parties to support nursing ratios because we need them now more than ever before. Since we were here last year, the healthcare staffing crisis has only gotten worse. In 2024, 8,000 nurses left our sector, more than any year during the peak of the pandemic. For years, Ontario has held the shameful record of having the worst registered nurse-to-population ratio in Canada. What it means is that nurses are spread far too thin. It means we are understaffed every single shift. This means we are sometimes working 16 and 24-hour shifts because there is no one available to take over. We've heard from nurses working in intensive care units with the most seriously ill patients who would normally provide care in a standard of 1-to-1 patient-to-nurse ratio, and they are now caring for up to 5 or more patients at once. That is an impossible, unsustainable job for any nurse. And it's not fair to our patients, your loved ones, who do not get the dedicated care they need. Because of nurse understaffing, Ontario hospital emergency departments were closed for more hours in 2024 than in any of the previous 3 years. And while we see ongoing closures, long wait times, and emergency department chaos, this government is failing to fund public health care. Instead, they are funneling public funds to private for-profit clinics, and that is a shame. This is the reality of healthcare in Ontario today, but it doesn't have to be this way. Nurses and healthcare professionals are fighting for nursing ratios because we know they save lives. Ratios improve patient health outcomes, they reduce the patient's length of stay, and they lower public costs. Staffing ratios make workloads more manageable, reduce burnout, and ensure patients receive the high-quality care they deserve. We have seen staffing ratios work in other jurisdictions where they were introduced. With ratios, we can bring back, retain, and recruit nurses and healthcare professionals. We need these nurses to meet Ontarians' demands. Nurses are watching this bill and will be watching this vote. With this bill, we are fighting for quality public health care. We're fighting for nurse retention, and we're fighting for safer hospitals. We need MPPs from all parties to come together, support patient care, and support this crucial legislation. Thank you.
Thank you very much. I would now like to introduce the CEO of We RPN, Nurse Diane Martin. Diane.
Good morning, and thank you, MPP Jelena, for inviting me back to Queen's Park to join fellow nursing leaders in support of the Patients to Nurse Ratios for Hospitals Act. I appreciate the opportunity to be part of this esteemed group during Nursing Week 2025. RPNs make up the second largest group of regulated health professionals in our system, with over 59,000 across the system. Nursing Week, this year, we are celebrating the contributions of RPNs who exemplify the belief that the nursing profession is more than just a job. It's a commitment and a cornerstone of compassionate care. This is how practical meets incredible, and we can't thank our RPNs enough. We know that nurses are the backbone of our healthcare system. They work tirelessly to provide care to patients in hospitals, long-term care homes, and the community. But in recent years, our nurses have been pushed to the limits as a result of the health human resources crisis. This has only compromised patient care, led to moral distress, and caused many nurses, particularly RPNs, to leave the profession. When nurses are trying to fill gaps that happen in a workplace when not the right number of nurses are available to work that day or are provided to work that day, they experience a very difficult situation. One of the things that we do as nurses is watch for the early signs that something might be going wrong with our patients. We do that so that we can put out a little fire rather than a big raising blaze if we miss key indicators that something's going wrong. And the more that you work, have patients assigned to you over and above what we've identified as safe, the more that's likely to happen. As revealed in our annual State of Nursing survey, which came out earlier this week, 65% of RPNs say they've witnessed an increase in experienced nurses leaving the workplace. And close to half of all RPNs say they are planning to or are considering leaving. When nurses are trying to meet the needs of their patients, the moral distress that they can experience can be pretty significant, and that has led to nurses who just can't face another day. Legislating nurse-to-patient ratios means that nurses will have manageable workloads to provide the highest quality care to their patients. It would also retain the nurses in the profession at the time when the demand is rapidly increasing. We also know that it works. Research has shown that nurse-to-patient ratios radically improve patient outcomes, reduce mortality rates, and decrease the length of hospital stays. Patients who receive care from nurses with lower patient loads are more likely to be satisfied with their care and have better overall experiences. Legislating nurse-to-patient ratios is not only good for nurses and patients, but it's a major return on investment for our hospitals. Speaking on behalf of the RPNs across the province, I urge all MPPs to support this important piece of legislation, as Ontarians in every corner of the province deserve the highest quality of care, which can only be delivered if our nurses have manageable workloads. Thank you.
Thank you, Diane. I would now like to introduce Angela Hudson. Angela is the president of CUPE 1974. Angela.
Good morning. My name is Angela Hodgson, and I am a registered practical nurse, and I've been practicing for 20 years. I'm also the chair of the RPN Committee on CUPE's Ontario Council of Hospital Unions, which represents approximately 50,000 staff in the province. I'm here today to speak in favor of this legislation and to explain why it is essential to improve the state of the hospital care in Ontario. As someone who has worked as a nurse in various departments, including oncology, medicine, and surgery, I can tell you that there is a vast difference in our ability to provide optimum care when we are properly staffed compared to when we are understaffed. 10 years ago, staffing levels were much more manageable, making it far easier to deliver quality care. While shifts weren't always perfect, being assigned 5 or 6 patients per nurse still allowed for timely and effective care. At times, you might have to stay a little late, skip a lunch, or miss a break, but overall, the workload felt manageable, and you didn't leave your shift questioning whether something was missed or if the care provided was compromised. Today, it is so much more challenging. Instead of 4 or 5 patients per nurse, it's far more common to be assigned 6 to 8 patients during your shift. It becomes virtually impossible to provide the kind of care that we are trained to deliver and we want to perform. By not being able to perform the quality care we expect, it causes moral distress amongst us. We go into nursing because of our compassion, because we have a desire to help people and improve their well-being. But when you're unable to provide the level of care your patient truly needs, when call bells go unanswered, medications are delayed, and there's no time to sit with someone, understand their condition, or simply offer comfort, you start to question yourself. You doubt the quality of care that you're delivering and carry the weight of feeling like it wasn't enough. These moments stay with you as a nurse. The constant sense of letting your patients down doesn't just fade. It settles deep in your mind and begins to weigh on your emotional well-being. Over time, the emotional toll starts to take a physical one as well. It is the reason so many nurses lie awake at night, burdened by the what-ifs and what could have been. Last year, when we surveyed CUPE nurses, 61% of RPNs reported trouble sleeping. 36% said that they suffered depression. 75% said that they experienced high stress levels. And 56% said that they dread to go to work. Obviously, this isn't sustainable, and it's the reason why we have been witnessing nurses quitting in droves over the last few years. Across the hospital sector since 2015, we have seen the number of vacancies shoot up to 330%. It's alarming to say the least. The good news is that there are solutions to this staffing crisis, and it starts by listening to the frontline workers and to implement the measures we are calling for today. Legislating nurse-to-patient ratios is an important step. We realize that legislation alone cannot fix this, but it will help with recruitment and retention. It'll give nurses hope that the system won't perpetually fail them. Having minimum nurse-to-patient ratios will guarantee that staffing levels never dip below the established threshold. It will mean that we'll have the time to properly assess our patients, provide the treatments and health teaching that is needed. It will mean that less rushed care, which decreases potential error. Allow the therapeutic relationship that nurses should be creating with their patients and reducing anxieties instead of contributing to them. Overall, it will mean better working conditions for us as nurses so we can fully take care of our patients. We have all the evidence showing that nurse-to-patient ratios make a difference in the lives of workers and patients. Staffing ratios were implemented in California 2 decades ago. We know that they lead to improved retention, lower rates of burnout, and job satisfaction. Ratios also help improve patient outcomes, including significantly lowering death rates. What could be more important than that? In this moment, when we are in crisis, we need to use every tool in our toolbox. Legislating nurse-to-patient ratios is a no-brainer. It's a common-sense solution that helps save lives. It's time the Ford government step up to do the right thing to help nurses take proper care of their patients in Ontario. And to do this, we must pass Bill 19. Thank you.
I would now like to ask my colleague, MPP Jamie West, to come and say a few words.
Thank you, France. Good morning, everybody. My name is Jamie West. I am the Shadow Minister for Labour. Over the last few years, we've been really looking at the healthcare crisis and the number of nurses who have been exiting this profession. The government has passed legislation to expedite and encourage people to get into nursing, but what we're seeing actually is a bathtub with both taps open and the plug removed from the drain. It might feel comforting for people to think of this as a hangover of the pandemic or from Bill 124, which certainly didn't treat our healthcare heroes like heroes. But the reality, I think, crystallized for me 2 summers ago. I was at a convocation at Laurentian University for a variety of programs, and the reception afterwards, I was congratulating students and asking them about themselves. And I met a young lady who had graduated from the nursing profession. And when I was excitedly telling her how badly we need nurses, she said, and very calmly, "I'll never work in this field." During my placements, I found out how nurses were set up to fail. And as a result, I'm going to find another profession. And that's what crystallized for me. It isn't that people are worn out from the pandemic. It isn't a hangover of Bill 124, although I wish we never went through any of that. The reality is the system is set up to fail. My colleague Lise Vaugeois from Thunder Bay Atikokan is with us. She's our expert for our party for WSIB, and she could attest for the number of WSIB cases that happen for nurses. And she could talk about the number of violent attacks that nurses have from patients. If you're sick and unwell, if you're in pain, if you're nauseous, if you're frustrated with wait times, if you don't see healthcare professionals around you for a long time, it's not acceptable, but I can understand how the increased violence happens. If you're a healthcare professional in the nursing field and you are exhausted and you're set up to fail and you hit that wall every single day and you come back every single day feeling like there's a system in place forcing you to fail, through exhaustion you'll make mistakes and become frustrated and eventually choose to exit the field early. We have to put the stopper back into the bathtub so that people come into the workplace. It's what's best for our patients, it's best for nursing. It's the right thing to do. I'm very happy to co-sponsor this bill with my colleague France Jalana. Thank you.
Thank you very much for all of people who spoke today. We all agree that we have a health human resource crisis throughout our healthcare system. The nurse-to-patient ratio is a proven solution to help with the human resource crisis that we face in our healthcare system. Healthcare system, you don't do widget. Healthcare system is the relationship between a health provider and a patient who needs care. We need to fix our health human resources crisis. We need to fix the crisis in our hospital so that we can recruit, retain, and bring back nurses. Le projet de loi 19, qui va mandater des ratios un maximum de patients par infirmière, est un projet de loi nouveau en Ontario, mais qui existe depuis longtemps, depuis plus de 20 ans en Californie, qui a été mis en place en Colombie-Britannique et on voit les résultats. Les résultats, c'est que la qualité des soins aux patients augmente, le nombre d'infections, de décès dans nos hôpitaux diminue, la violence dans nos hôpitaux diminue et pour les infirmières, ils sont capables de faire face à une charge de travail qui est humaine. Elles sont capables de savoir que lorsqu'elles vont aller travailler, elles vont être capables d'offrir des soins de qualité. Une personne décide d'être infirmière parce qu'elle veut, infirmière parce qu'elles veulent nous aider, parce qu'elles veulent aider les gens. Mais si on ne leur donne pas le temps pour offrir des soins de qualité, on parle de burn-out, on parle d'anxiété, on parle d'infirmières et d'infirmiers qui laissent la profession. On a une solution. Le projet de loi 19 est là. J'espère qu'on va pouvoir compter sur tous les membres de l'Assemblée législative pour que ça devienne loi en Ontario. Mais je peux vous garantir que les 180 000 infirmières et infirmiers qui existent en Ontario, vous allez en entendre parler parce qu'elles veulent et ils veulent que ce projet de loi-là soit mis en place. Thank you so much, everyone, for coming this morning. Merci beaucoup d'être ici aujourd'hui. Chemewech. On est ouvert pour des questions. We can take questions. Thank you. Merci.